Today we're diving into a fascinating new study that explores the potential role of vitamin D in reducing blood pressure. Could something as simple as vitamin D supplementation improve heart health? Well, we'll find out in this video. Welcome back. I'm Dr. Marie Azizian, a board-certified general surgeon and IFM-certified functional medicine physician. So let's look at the background first. For years, research has hinted at some connection between vitamin D deficiency and cardiovascular issues, including high blood pressure. However, studies on whether vitamin D supplementation can actually lower blood pressure have delivered mixed results until what looks like now. So this recent study conducted by Dr. Fuleihan and her team at the American University of Beirut provides new insights. So here's the study design. The researchers focused on 221 individuals age 65 or older with a BMI over 25. So these were overweight individuals, and their starting vitamin D level was measured, and it was in the range of 10 to 30 nanograms per milliliter, and of note, the normal vitamin D level is 20 to 40. All participants were given calcium supplementation with one of two dosages of vitamin D3. The low dose group got 600 and high dose group got 3,750 international units per day. Their blood pressure readings were taken at baseline, 6 months, and 12 months. What was the goal? The goal was to determine whether vitamin D with calcium could lower systolic and diastolic blood pressure depending on the dosage. And here are the key findings. But before we move on, if you're enjoying this video so far, please don't forget to like, share, and subscribe so you don't miss any of my upcoming videos on a variety of medical topics, including functional medicine, supplements, latest medical research, and more. So here's what the researchers discovered. First, there were overall improvements. Both systolic, top number, and diastolic, bottom number, blood pressure dropped in the entire group. The average reductions were systolic blood pressure 3.5 millimeter and diastolic blood pressure 2.8 millimeter. They also found out that BMI mattered. For participants with a BMI over 30, reductions in blood pressure were even more pronounced, especially in the high dose group. Systolic blood pressure improved with both high and low doses of vitamin D. Diastolic blood pressure only dropped significantly in the high dose group. Another important finding was that those diagnosed with hypertension, high blood pressure, benefited from vitamin D supplementation regardless of their BMI or dose. So what does it mean for practice, actually? So Dr. Fuleihan summarized it well. So she said vitamin D supplementation appears to lower blood pressure in certain groups, particularly older adults, those with obesity, and possibly those with low vitamin D levels to begin with. However, higher dosages of vitamin D don't necessarily yield additional benefits beyond the recommended daily amount. So what is the takeaway? This study highlights an exciting potential benefit of vitamin D for improving heart health, but it also emphasizes that context matters. Factors like BMI, existing health conditions like hypertension, and baseline vitamin D levels can influence outcomes. And that's why actually I love this study, because it's so personalized and specific. So, however, we also need to look at some limitations of this study. First of all, the study focused on older adults, older individuals who were sedentary and overweight, and many of whom already had prediabetes metabolic syndrome. So all of these conditions have an impact on blood pressure by themselves. Also, the possible effect of calcium alone on blood pressure reduction was never studied. It was unclear. I think it would have been very nice if they had a group that received only calcium without vitamin D and measured the blood pressure. Recently, actually, I had a patient who was telling me how hard it has been to adjust her blood pressure medications for her and for her cardiologist, because she was becoming dizzy due to these medications, and they had to increase them, then lower them, and etc. So, and it's interesting because these types of studies, like the one we just discussed, help us start building the template for taking the burden from pharmaceuticals to healthy supplements and minerals. And I actually have a video about how certain dosage of magnesium can also decrease blood pressure in some people. So in the future, it would be nice to be able to get rid of all the pharmaceuticals. However, please do not stop or change any of your blood pressure medications before discussing with your doctor. If you are considering vitamin D supplements for blood pressure management, talk to your doctor first, of course, as always. Thank you so much for watching. Please leave in your comments if you take vitamin D, how much do you take, and how does it make a difference for you? Do you feel any benefits like more energy, or perhaps you're one of these people who have noticed some decrease in your blood pressure? That would be interesting to find out. So again, thank you so much for watching. Until next time, bye-bye.